skeletal leg model.
Action.
Okay. Cross-sectional view of a cervical vertebrae with the spinal cord in position. Okay, so you should know the parts of the bone: bifid spinous process, lamina, superior articular process with the facets, body, uncinate processes, transverse processes. There's a transverse foramen, and in the foramen you have the vertebral artery and some of the veins. Spinal cord and its coverings. You have the white matter in its sections: posterior, anterior, lateral. The gray matter, this has all three horns. Okay, you have the dorsal, lateral, and ventral horns. The commissure, the central canal. There's the fissure, anterior median fissure. The covering, the white covering around it, that's the pia mater, the innermost. Then there's a space, and then you come to another layer. It's adhered to the outer white layer here, but right inside of that, that's the arachnoid mater. And then this outer one that actually goes all around, covering all the roots and spinal nerve. The outermost one here and out here, it's the dura mater. That's surrounded by adipose tissue, and you can see some blood vessels in there. And then there's a gray layer outside of that running along the lamina, ligamentum flava. There's adipose outside the dura here. There's a gray ligament outside of that. There's the posterior longitudinal ligament. Okay, of the spinal column. Coming off of the spinal cord, you have your roots. You have your ventral roots. These are actually rootlets that give rise to the root. It's narrow. And then dorsal rootlets giving rise to the root. It's a little wider. And then it gets super wide, the dorsal root ganglia. And both of those come together to form the spinal nerve. What some of you, here we have it here covered, dorsal root ganglia. Some of you are wondering, well, there's the spinal nerve. Well, what's this other stuff coming on? That's a good question. Those are the branches of the spinal nerve. Meaning once the spinal nerve comes out of the intervertebral foramina, it has to now branch and go to different parts of the body. Okay, there is a branch, the dorsal branch, and this is where it gets a little confusing because this is called the dorsal root, then it becomes the spinal nerve, then there's what we call a dorsal ramus. Ramus is the branch off of the spinal nerve. Ramus is not root. Root is different than ramus. Ramus is outside of the intervertebral foramina. It's after the spinal nerve branches. Dorsal ramus, ventral ramus. The dorsal ramus comes off of the spinal nerve and it goes and innervates all the muscles and somatic tissue of your back. All those muscles we learned about on the trunk are innervated by neurons from the dorsal ramus, the branch that comes off the spinal nerve taking care of the back. The ventral ramus takes care of everything on the side of your body, everything in front of your body, your arms and your legs. Look at the size of the ventral ramus compared to the dorsal ramus, much bigger, because it takes care of the sides, the front, your arms, and your legs. All those parts are the neurons for them are found in here, the ventral ramus, off of the spinal nerve. There's a branch for the sympathetic nervous system that comes off of the spinal nerve. Okay, it's called the rami communicantes. Rami communicantes. That's for the sympathetic nervous system. And it's not shown here, but there's another branch that comes off, the fourth branch. It comes off of the spinal nerve and it actually goes back in through the intervertebral foramina and it innervates all these things in case you have pain or something going on in here. It's called the recurrent meningeal nerve. Recurrent because it goes back in. Meningeal because it innervates the meninges. So there's 4 branches off of the spinal nerve. The dorsal ramus, back of the body. The ventral ramus, side and front, arms, legs. The rami communicantes for the sympathetic nervous system. And the recurrent meningeal not shown that goes back in and takes care of the cord.
What's this again? I'm sorry. The little fan part.
This one
Yeah.
out here?
No. Because you have like the anterior fissure and then
This is the posterior median sulcus,
posterior median
anterior
sulcus.
median fissure,
Okay.
central canal.
Can you say the ligament, the name of the ligament?
Ligamentum flavum,
Ligament.
posterior longitudinal. There's also an anterior longitudinal not shown. But I may make one and put it on.
Really?
Just for texting. I'm constructing it at home tonight.
All right. And